Assalamu alaikum. My name is Varda Asher, having roll number BP1650250. The topic I'm assigned is magnesium hydroxide. So what is magnesium hydroxide? Magnesium hydroxide can be used as an antacid or a laxative in either oral liquid suspension or a chewable tablet. Additionally, magnesium hydroxide has smoke suppressing and flame retardant properties. That is why used commercially as a fire retardant. It can also be used topically as a deodorant or for the relief of canker sores. Brand name of magnesium hydroxide is Milk of Magnesia. Main indications. As an antacid, it is used for the temporary relief of heartburn, upset stomach, sour stomach, or acid indigestion. As a laxative, it is used for the relief occasional constipation by promoting bowel movements for 30 minutes and up to 6 hours. Side effects. The side effects of magnesium hydroxide are abdominal cramping, diarrhea, electrolyte imbalance, hypertension, muscle weakness, and respiratory depression. Doses. The doses are different for both adult and in pediatrics. Dose adjustment in patients with different diseases. So in constipation, constipated adults, magnesium hydroxide is given 30 to 60 ml per day, orally at bedtime or in divided doses. Or the adults having acid indigestion are given magnesium hydroxide 5 to 15 ml orally every 4 hours, no more than 4 doses per 24-hour period. Drug interactions. There are different drug interactions with magnesium hydroxide. Some of the drugs are given below. Number 1, acetaminophen. Magnesium hydroxide can cause a decrease in the absorption of acetaminophen, resulting in a reduced serum concentration and potentially a decrease in efficacy. Number 2 is acyclovir. Acyclovir may decrease the excretion rate of magnesium hydroxide, which could result in a higher serum level. Aldosterone is the third one. The bioavailability of aldosterone can be decreased when combined with magnesium hydroxide. We have different alternative drugs for the magnesium hydroxide. The brand names are given. Number 1 is Digex MP Carbonative of Abbott Laboratories, Siam of Ifrose Chemical Industries, and Dyneco of Mactor International Private Limited. Case study. We have given a case study of a young lady who is facing constipation. So the case is as follows. A young patient with abdominal pain aged 16 years asked to speak to the pharmacist. She would like something to help her to go to the toilet as it has been 4 days and she is experiencing stomach pain. She is unable to describe the nature of the pain. She's having constipation for the first time. Not know. And is she experiencing any stress? Does she have taken any medications or supplements prescribed or bought over the counter? So let's have a look on the SOAP notes. The first is subject. The chief complaint of the patient is that she's facing constipation and stomachache. Object. Not much information is given, but the age and the pain she's facing is given. The age is just 16 years. After seeing the case, I assess that the patient describes pain as cramping, but explained that she doesn't think it is from menstruation, as her period was more than a week ago. She cannot remember having constipation before and usually goes to the toilet once per day. She is not currently on any prescribed or OTC medication except a moisturizer for her eczema. She explains that she is not stressed and that her routine is as simple as always and she has not tried anything. Plan that I have made is that she should take up to 3 days for the bulk forming laxative to have an effect. If it fails, then she must switch on to an osmotic laxative and one must clarify the directions of use to her, that she should not take it immediately before bed, or that she should avoid drinking tea and other diuretics while the symptoms are present, as it may worsen them. And if the osmotic laxative, the second drug of choice, fails, then we move towards the third drug of choice, that is our main drug, magnesium hydroxide, as a stimulant laxative. If this further fails after 5 days, then she should need to go to her GP as recommended. The information that I have provided are taken from these references, Koda Kimball, Goodman Gilman, and different sites as given. Thank you so much.